Miller and Sanchez proposed 6 elements summarized by the acronym FRAMES, in which to provide a framework for brief intervention. Most health professionals delivering brief interventions provide patients with personalized feedback on their risks for substance use problems based on such factors as their current drinking or substance use patterns, problem indicators such as laboratory test results, and any medical, social, or psychological consequences of their use. This is often done in the context of a screening test such as the audit or assist. Perceived personal control has been recognized to motivate behavior change. Therefore, brief intervention commonly emphasizes the patient's individual responsibility and choice in reducing or stopping use. In some types of brief intervention, professionals give patients explicit advice to reduce or stop use. While expressing concern about the patient's pattern and the related health risks, the healthcare professional may discuss guidelines for lower risk drinking or drug use. Utilizing tools such as a decisional balance or readiness ruler can help develop discrepancy and promote change talk, thereby enhancing motivation. Health professionals providing brief intervention may offer patients a variety of strategies from which to choose. These may include setting specific limits on consumption, developing skills to avoid use in high-risk situations, and learning to cope with the everyday problems that may lead to drinking or drug use. A warm, reflective approach that attempts to understand the patient's point of view is more effective than an aggressive, confrontational, or coercive style. Research has found that patients' drinking was reduced by 77% when practitioners used an empathic counseling style as opposed to 55% when a confrontational approach was used. The practitioner should use an empathic style throughout the brief intervention. Health professionals delivering brief intervention commonly encourage patients to rely on their own resources to bring about change and to be optimistic about their ability to change their behavior. Feedback is the first step in the delivery of a brief intervention. This component highlights certain aspects of a patient's behavior using information gathered during screening. It involves an interactive dialogue for discussing the screening findings and is not just provider-driven. Feedback should be given in small amounts. After describing the risk level and meaning of the level, low, moderate, or high, the provider then gives a specific piece of feedback and asks for a response from the patient. Most health professionals provide patients with feedback on their risks for substance use problems based on their presenting health concern. Factors such as an individual's current drinking pattern, laboratory test results, or other medical consequences of their drinking may be used for feedback. For example, a physician may tell a patient that his or her drinking may be contributing to their hypertension or may increase their risk for heart disease. Since screening identifies many who are at risk and not yet experiencing harms, this may not always be possible, but feedback should always be personally relevant. The provider should always ask permission before presenting the screening scores or in providing feedback. Note that feedback should be provided using an empathic style, that is, neutral and non-judgmental. And the practitioner should always avoid labels like drug addict and alcoholic. Eliciting personal interpretation, which may be done at several points during the intervention, entails asking the patient what they think about the information and what they would like to do. You can do this by asking one of the following key questions. Where do we go from here? What would you like to do about that? What concerns you most?
So Deborah, thank you for sharing the information with me. Would it be okay if we discuss the results together? So based on your answers, you scored in what we consider the moderate risk category, which means you're at some risk for some health or other problems because of your drinking pattern. Yeah, you had mentioned that you have these heart palpitations after a heavy drinking episode. That's because acute alcohol ingestion can cause these kind of short circuits in the heart's electrical rhythm. What are your thoughts about that? So, in order to reduce your risk of some of the symptoms that we talked about, my advice to you is that you cut back on alcohol or stop drinking altogether. Now, the decision to change is entirely up to you.
Emphasize the patient's responsibility and choice for reducing substance use. Perceived personal control has been recognized to motivate behavior change.
May I share some information with you that has helped other people to lower their risk? So for women of your age, we recommend no more than 1 drink per day or 7 drinks per week, and no more than 3 drinks on any one occasion. And that's because we know that individuals who regularly drink above these limits put themselves at risk for long and short-term problems because of their drinking. What are your thoughts about some of these lower risk drinking limits?